All right, sir. Chairman Hefner, Vice Chairman Lopez, and distinguished members of the committee. My name is Ammon Blair, and I'm a senior fellow at the Texas Public Policy Foundation. I'm honored to appear before you today in strong support of House Bill 4993. I bring 22 years of military experience, including service in the United States Army and the Texas Army National Guard. The Texas military forces are facing a deteriorating readiness environment that threatens both state and national security imperatives. Although the Army and Air National Guard operate under dual federal and state authority, it is the state of Texas that holds the statutory responsibility to train these forces to meet the readiness standards set by the federal government. A study released just last week by the American Security Project found that more than 2/3 of Guard and Reserve members are now classified as overweight or obese. This compromises not only their ability to deploy, but also their day-to-day operational readiness. The study warns that the Guard's ability to respond rapidly to national security threats and domestic emergencies is in serious jeopardy unless urgent reforms are implemented. In Texas, part-time Guardsmen train a fraction of the time compared to active duty. They are spread across vast distances, often without access to adequate training facilities, wellness programs, or basic fitness infrastructure. Unlike the active duty, the Guard operates with persistent disparities in funding, support services, and oversight. Wellness programs go underutilized, accountability is virtually non-existent, and time for physical training is painfully limited. The result, a force unfit, underprepared, and unable to meet the demands of today's missions. Secretary Hegseth sounded the alarm over these findings, stating, this is completely unacceptable. This is what happens when standards are ignored, and this is what we are changing. Real fitness and weight standards are here. We will be fit, not fat. House Bill 4993 delivers that change. It establishes clear, enforceable fitness standards. Aligned with mission requirements, it ensures every service member, regardless of geography, has access to real training support, digital health tools, and comprehensive wellness services. It embeds accountability through quarterly legislative reporting and corrective action plans. And most importantly, it restores the warrior ethos by rewarding performance, not just compliance. This is not a pilot or a platitude. It is a fully developed, scalable solution that equips Texas to lead the nation in rebuilding readiness from the ground up. I yield to any questions.
Members, questions? All righty, Ammon, thank you for your testimony.
Look, I believe in investing in health. Obviously, I think the military, in my experience with Texas military forces on the border for a year, was they work very hard. And they're very proud of what they do, and they've done a heck of a job for us down here the last 4 years. It's almost like they're too busy to train to go into a physical fitness regimen, or they're so busy that it may only be 45 minutes, maybe 30 minutes, maybe 15 minutes. So it was very, because their task was huge. So what they were to build fence, to build just any number of things down there, they were required to do. But let's go into some things that probably are very important about this bill for the state to get involved in this and spend the kind of dollars we want to spend on this to have a ready force. So, as Hammond, what are the estimated costs and the cost savings estimate of this program on an annual basis?
Yeah, so Mr. Hitchens could probably answer in regards to the app, but in regards to like a fitness facility, really, if you're looking at creating fitness facilities, right now we have 65 armories or National Guard facilities around the state, providing exercise equipment for that. That's going to be somewhere between $1,000 to $3,000 per site. And then also to include gym memberships. So if you look inside the bill there, it talks about having a gym membership that can range from anywhere from $9 if you're going to go to Planet Fitness. Don't drop the weights there, but if you're going to go to Planet Fitness, that's going to be $9 all the way up to $30 for a Gold's Gym, and that's going to be for every member. But really, the cost itself, or the most important piece of this, like you said, when you're really busy, when you're out there on the mission on Operation Lone Star, I served on Operation Lone Star as an officer down there. You were not going to have a gym around you at all. And so really having an app that can give you the workout plan, that can give you the nutritional plan as well, regardless if you have weights around, that's really where it lies in. And Mr. Hitchens can talk to that cost.
We've got a pretty good fiscal note on this. What would this do for the state of Texas if we were to do this? What kind of position would that put us in if our state guard was supported like this?
Sir, I would like to say just a few minutes in regards to that to answer that question. So, well, many people don't know, on Operation Lone Star, the soldiers and airmen are not forced or not coerced to do actually PT. So when you're down there on Operation Lone Star, you're only covered on through workers' comp on the 10-hour shift. They're temporary state active duty or state employees. Therefore, a company commander cannot mandate physical fitness training after hours. Your hours, say like you are going to be on there on the river, looking on the river, you're there for 10 hours. The company commander cannot make you work out afterwards. So what we're seeing is actually an eroding of readiness standards on Operation Lone Star, which is about between 4,100 and 4,700, which is about a quarter of our soldiers. As I said before, the fitness standards, like I've been in almost 22 years. I was almost in 22 years. I was a drill sergeant back in 2008, so I was the one that was screaming in people's faces, trying to make soldiers or citizens turn citizens into soldiers. And the standards themselves have actually slowly decreased within the last 20 years. And we can see it now. That data that was just published last week showed that the Army National Guard, not just the National Guard, but also the reserves are at 68% overweight or obese. And to talk what Mr. Hitchens talked about in regards to cost, there was an additional study that was done or released last year that showed that due to all the unforeseen circumstances of being not fit, it cost the military almost $1.35 billion. So this is going to be, like, we see this as a fiscal note to pay for this app or to pay for these services. But at the end of the day, we're also making sure that we're not going to be paying for other health or second or third effects from being unfit.
Thank you both.